The U.S. Department of Health and Human Services says about 1 out of every 4 kids nationwide is the victim of bullying. That's a huge number. But a local organization is trying to cut those numbers down. We talked to Dr. Odell Owens about the safe spaces Interact for Health has created for kids in our community.
When we think about bullying, oftentimes we want to associate bullying with schools, but unfortunately bullying can happen everywhere, including the adult workplace. And that's why we should be concerned, because this is not just a problem with children. It may start in the earlier years with children, but it's not a problem just for children. There are multiple types of bullying. Some is physical, but some are more just verbal, where people want to hurt you with words. They want to hurt your reputation. Are they looking to provoke a response? They want to see you cry. They want to see you beg. They want to see you run. It certainly has physical health implications. You know, when you think about bullying, there are 3 components. There's the person who's bullying, there's the child who's being bullied, and then there's those who watch. The one who's being bullied, more than likely they were bullied. And certainly the child that's being bullied suffers most of the emotional damage. Children who are bullied certainly are going to be unhappy. And if you're unhappy, that's going to impact the kind of student you're going to be. Your grades are going to suffer, and we've seen that with kids making great grades get bullied and the grades drop. And that's one of the early signs for the parent to go and talk to the school that what's going on with their child. They're going to become depressed. They're going to become withdrawn. And the ultimate sad part is that some of them may seek suicide for relief. When kids are bullied, oftentimes they'll complain to their parents about a variety of symptoms to ensure they don't go to school. They wake up happy, and then they realize they got to go to school that day, and they're going to start having some pains in their abdomen. They may even vomit. So a lot of anxiety, because they know when they go to school, bullying is waiting for them, and they're going to be unhappy. Some of the more subtle signs of a child who is doing the bullying may be that that child's in a lot of confrontation in school, a lot of arguments. Maybe they're getting phone calls from other parents or from the school saying that your child is aggressive. And sometimes the word aggressive and bullying may be the same. Through our school-based health centers, I think the first line of defense is our nurse practitioner, and that's a trusted person that a student can share that concern. And also, I think they're trained to look for those early warning signs and bring it up even if the child doesn't bring it up. We're fortunate that at Road Hill Academy, which is a Cincinnati public school on the west side, they have a group of students called the CARE Crew, and they're dedicated to stopping bullying. So they try to promote healthy activities and try to encourage kids to get along. I think that's a start, a wonderful start, because it really has to come from the kids. Because the problem is in the kids, solutions got to come from the kids as well.
For more information on how to keep your child safe from bullying, you can give Interact for Health a call at 888, that's 888-310-4904, or check them out online at interactforhealth.org.